Greetings. Welcome to This Is My Health, a show that seeks to give you information and empowers you so that you can take full control of your own life. Today, we are going to be looking at a very interesting topic. We've called it just simply Pandemics and Epidemics. In the studio to assist me to unpack this topic, I've got two young doctors, Dr. Brendan Matthews, an upcoming family physician. Welcome, Doc.
Thank you.
And Dr. Rutendo Matanda, an upcoming physician. Welcome, Doc.
Thank you for having me.
Thank you. Now, my colleagues, help us out here. The human race has been dealt a serious tornado. Over the last couple of years, now it's coming 2 years, we've acquired a new vocabulary. Things like epidemics, pandemics, and endemic, words that we never heard. Can you please help us first by understanding that before we can get into this? Dr. Brendan.
Yes, thank you for that. Quite rightly so. We've come out of a tumultuous few past years in our world's history, And what we've come to speak about so much is the COVID pandemic, And quite recently, we've now started hearing that it's now endemic or a COVID epidemic. And really what those words speak to is that pandemic speaks to a disease which involves or spreads to a vast geographical area, if not a whole country, a whole continent, or the entire world, as what was in the COVID-19 situation. And really it also speaks to the rate at which that disease spreads. If something starts out in one person's home and spreads to the village, the whole community, the country, and the whole world, it becomes a pandemic because of the speed and the ability it has to spread so fast and to such a vast area as well.
Okay, so then when it doesn't do that, then we call it an epidemic maybe? And then you said endemic. What does endemic mean? They tell us COVID now is endemic.
Yes, so when we talk about an endemic disease, this is a disease that has come to stay. It's not going anywhere. It is with us. So it's not going anywhere. I can give an example of malaria. There are malaria endemic areas. These are areas that we just know. These areas have malaria. It's not going anywhere. And then there are some areas which never have malaria. So when we are saying endemic, this is a disease that's there to stay.
Okay. I assume that in you talking about how it's spreading and how fast, it speaks to the causes of us using the name. So what I'm wondering about now is during this pandemic, we saw a lot of strict protocols. Protocol is another word we've gained now. Wash your hands, cover your mouth, all those things. Is that common? If somebody ever says pandemic, are we supposed to expect that? Is that how pandemics are dealt with?
Okay, so in our case with COVID-19, we had to do that to stop the spread of the COVID-19. As pandemics happen, it depends on how exactly is it being spread. That's going to inform the protocols we're going to be given to stop its spread. For example, I'll take the COVID-19 that we're coming from. We know that it was spread, it was a droplet spread, right? So the protocols were informed by the form of spread that the disease has. So we had to social distance, keep a distance between the next person and the next person. We had to cover our mouths and our noses to prevent anything flying to the next person. In some pandemics, depending on how they spread, people can be asked not to share clothing. People can be asked to keep their distance. It just depends on how we have understood the disease to spread. That informs the protocols.
Okay, thank you. You know what? We've got somebody who is just called in, one of our viewers who would like to discuss something with us. Can we just take a moment to see what they have to say?
Hello, I go by the name of Precious Mashasha, and I'm an unemployed youth, sadly. I just finished studying acting for camera, which hoping for good news. Anyway, get back to the question. My question is that, as we all know, is that COVID-19 has done more harm than good, and we have lost our loved ones. And unfortunately, this thing is here to stay. All around us, we always hear people saying that this is actually a pandemic. Now, my question is that, what are the epidemics and pandemics around it? How does one navigate or maneuver around it? What are the myths about COVID-19?
Thank you for engaging with us, to our listener. And now that we have run out of time, it's amazing how fast time goes. We're going to take a short break, and then when we come back, we'll have a little bit more time for us to unpack the issues that were raised by our caller. Welcome back. If you've just joined us, you're watching This Is My Health. And today we are looking at pandemics and epidemics. Before the break, we had just had a caller who raised some issues that we would like to unpack right now. Welcome back, doctors.
Thank you.
Now, as we were talking about the protocols that have been put in place, as you have heard in one of our callers, different people have got different ideas of what should or should not be enforced. And that's possibly because beyond the medical conditions that we deal with, these protocols and things, they affect us also socially. Now, what I want you to assist with at this point is, what really is the impact of me not implementing or not doing the things that are supposed to be done? Maybe I'll start with you, Doc.
Yes, this is actually an important part, a very important question. I want to thank the viewer for that. I want to start off, give a quick example of the flu. The common flu, we see it more in winter, but winter doesn't bring the flu. It's us. When we're getting cold in winter, we are closer to one another and we pass flu amongst our homes much easier. And that's an easy example to explain that how diseases are spread to one another. It's easy with the flu to say that, no, the whole household got the flu, but we're all fine now. But when you dealt with a pandemic, which we didn't know anything about, we were all scared about, and we saw the devastation it caused, it was very important to put those strategies, those protocols in place to prevent widespread, even worse devastation than what it already caused. So those are very important, and I just want to go on one point as well. I am in family medicine. I deal a lot with community, at the community level, at the home level. And I went into families' homes. People came into my clinic devastated by COVID, having lost their father, losing their parents, losing whole families, children being left alone, losing breadwinners, losing role models. And till today, we feel those effects. Today, people have depression. Today, people come into our facilities with anxiety because of what this pandemic has done.
Yes.
So when we think of these protocols, we must firstly know they've always been there. And secondly, they're there to protect everyone, me and you, and not to try and down press your rights as a person. Yes.
Thank you very much for bringing that up. COVID is not the only epidemic or pandemic that we have had to deal with. In our territory here in Southern Africa, we have an epidemic that we don't talk too much about, malaria. Earlier on, you talked about endemic areas, but then the endemic areas are in different countries, which makes it an epidemic. Could you say something about some of the protocols, not necessarily just for COVID, because in the same manner of devastation, malaria, we get that and we get protocols. Would you like to talk about that?
Yes, thank you for that question. It's quite a very important thing. Of course, COVID, we were all learning as we were going through it. But for things like malaria, we all know the protocols that are supposed to be involved. And this is what I'm going to get into. We all know that we must make sure not to keep pools of water around the house, because that water, that stagnant water, is going to be the breeding place for the mosquitoes that are going to then give us the malaria. So we do encourage people, don't keep pools of water around your house. We do encourage people to use treated mosquito nets. Not just a mosquito net just to pick and cover your bed. It has to be treated. So we need to keep that. We need to make sure that you have treated mosquito nets to cover yourself. We also encourage people to wear clothing that covers as much skin as possible, especially as the sun goes down, because that's when the mosquitoes become more active as well. They rarely bite you, at midday. So as the sun is going down, we encourage people to quickly put on clothes that cover as much of your body as possible. There are some mosquito repellents as well that people, if you can afford them, you get your hands on and you do use the mosquito repellents. At a government level, governments are encouraged to make sure all those areas, they are sprayed, in masse, they're sprayed at a bigger scale. This is really not the person's protocol. It's mostly to our governments in our communities. They need to make sure they spread all those areas to try and keep down the mosquitoes, and we follow those protocols to protect ourselves from malaria.
Thank you very much for bringing up the issue of spraying, because some of the things that I think Doc, who works at the community level, experiences is the resistance, where people don't want to have the spray. Remember, we are talking about the pandemics and epidemics, things that if I resist, then the community suffer.
Yes.
What would you like to say to those people who don't want their houses to be sprayed during a time where governments are coming to protect?
As I was listening to my colleague speaking, I was thinking about how all the measures she spoke about malaria, we accept them and we implement them so easily and happily so, because we know what it can cause if we don't. I think because COVID-19 is so new, we still learn about it. There's still that resistance. We do also need to be sensitive to people, we need to have that heart and that eye to say, let's continue education. Let's not condemn people, who say, I don't want my house to be sprayed. I don't want to wear a mask. Because people do still die from COVID-19. It is still important. Yes, even today, people are still passing away from COVID-19, unfortunately. So us as healthcare professionals, we need to continue education. We need to be sensitive to people and continue education, and not just leave someone when they dismiss you, but actually, in a Christ-like manner, Christian manner, continue education and continue that support with that person. Yes.
It's a good thing that you brought in the aspect of us knowing and accepting what is actually in place. I found it quite interesting, the issue of hand washing. I would imagine all of us have washed our hands and place where to wash hands. But I was taken aback at the resistance, even at the issue of hand washing during COVID. But that as it may, I wondered also about another epidemic that is endemic to our area, cholera. Would you like just to talk on just 1 minute, as our time is running out, on the issues of cholera, which is also another epidemic that we deal with? Yes.
Okay, thank you for that. So the epidemic of cholera, the protocols are almost the same as COVID. The emphasis is on wash your hands all the time. You can never overwash your hands. Anytime you get in the hospitals, you know what you were doing. There was a nurse who was in charge of keeping time. After a certain time, she would ring a bell, and then everyone washes hands, whether he had touched the patient or not. When you hear the hand washing bell, you just go to the next sink and you wash your hands properly using soap or using ash. So please always wash your hands, even if you find no good reason for doing it. Just wash your hands.
Yeah, and in cholera, as we know, cholera gets spread also through hygienic methods, and therefore it is even more so to have places for washing hands. I'm hoping that, Doc, as you go around in the villages and the communities, you are finding that people had set up places of water so that they could wash their hands readily. My honest hope is that now that the COVID pandemic seems to have subsided a little bit, we are not going to shut down those taps. I'm hoping that we will keep up the hygiene and all the things that we had been doing during COVID. And I hope that we, in the health profession, will actually continue to help people. Our time has run up now. We are going to go for a very short break. But when we come back, I would like us to look at something very interesting to me, myths around pandemics and epidemics. Everybody out there has got their own questions and myths, and they've sent in a number of questions from our viewers. And I would like us to look at those questions, and hopefully you can help shed some light on those. Please don't go away. We'll be right back. Welcome back. You're still watching This Is My Health, and now we are coming to the winding part of our discussion today on pandemics and epidemics. As promised, we would like to look at some myths out there. The bulk of them are really around COVID. I'll start with you, Doc. Help us unravel this one. A question has come which says, you can protect yourself from COVID-19 by injecting, swallowing, bathing in, or rubbing onto yourself bleach, disinfectant, or alcohol. Is that true?
Well, that is a myth. And I think it was the president of one of the big countries who mentioned something like that, and it spread like wildfire during the early times of the COVID-19 pandemic. Yes, it is a myth. In fact, it's very dangerous to ingest those substances, you know. A virus such as COVID-19 is within our bloodstream. It's at a cellular level. It's at a chemical level. It's not at a level where we can ingest another chemical, which will only erode and eat our internal organs, you know. So very dangerous, very, very dangerous to go along that. And we should really, before we get to try and implement things we hear about, we should really test them first.
Okay, thank you. Another one that came says, warm water or saline water will protect you from getting sick if you are exposed to the COVID-19 virus. Is that true, Doc?
Okay, so we all know water is good. Yeah, we agree. Water is very good. We want us to drink water, but we want to avoid claiming what water won't be able to do. So taking saline water and, you know, what percentage of the saline water are you going to make to drink? Because drinking that saline water is going to make you dehydrated. You're going to actually end up needing to be given a drip with some water to,
How so?
to cover up.
How does water dehydrate you?
Okay, this is saline water. You're not just taking water. Saline means you've put some salt in it.
Oh, okay.
You have made your own saline. So there is percentages to these salines. The one we use, for example, in the hospital is 0.9%, the one we call normal saline. But even at that, we don't give it freely because we call it normal saline. So the saline that you're going to make to drink, what saturation are you going to use? What percentage is it going to be? How much sodium is there? How much chloride is there? Sodium and chloride are going to be separated when they're in your body, and they are going
These
to...
are components of salt.
Yes, these are components of salt,
chloride.
sodium and chloride. And when they're in your body, at the cell level, like my colleague was saying, they can cause chaos. So sodium is tightly regulated by your body, and chloride is also tightly regulated by your body. And when you come to the hospital, we want to try and see what's wrong with you in your system. We take blood. We also check what's the level of the sodium in the chloride, because there is set limits as to what it's supposed to be. At first, when you do take, your body can fight and do what we call homeostasis, bringing you back to the normal.
Balance.
Yes, bringing you back to the balance. Your body can do that, but sometimes you tax your body so much, then it fails.
So you are saying
to do
this thing
that.
can kill you if you are going to take a lot of
Yes,
saline?
it can. It can. Exactly. You can. It can. It's going to. It can kill you. So
Okay.
you can't.
Scary stuff. So that myth, no to. Here is another one now. This one I have heard also, other than the questions that I have, says ivermectin cures and can prevent COVID-19. What is ivermectin and can it?
Ivermectin, let's first start off there. It's been really proven now robustly that ivermectin does not cure COVID-19 and does not have any effect in whether it reduces admissions or severe illness. Ivermectin is not used traditionally for humans. It's an animal medication. It's to treat parasites. It's not to treat viruses as what COVID-19 is, And early research purported to say that it helped. But if me and you drink ivermectin and we get better, we can say that's research, therefore ivermectin works. And that's not how research works. Research works over time, over a large amount of participants. And finally now, recently, I think about a month ago, we've got robust research proving that ivermectin has no benefits, in fact, harm. It can cause harm because ivermectin is killing people as well these days.
So it was just per chance that there were people who said they felt better. I'm sure you also heard about that. There are people who swear by ivermectin.
Even in our families, I'm sure we could.
Yeah, we have.
We came across
had,
people,
Yes.
We've had patients trying to get their relatives smuggle ivermectin into the wards.
Okay.
So, like he is saying, proper research needs to be done with the same, with the proper spread over time, proper spread over the population
And
being
standards.
considered, and the standards being, and once you say ivermectin works, it has to be reproducible.
All the time.
Yeah,
Okay.
all the time.
Now, thank you on that one. Here is another one. Mosquitoes can transmit COVID-19. Can they?
No.
We just talked about mosquitoes and malaria.
Yeah.
Can you
this
talk about
this
that?
was a big topic as well when the HIV pandemic started. Can mosquitoes transmit HIV to one another? But we've come to realize that viruses, they have something called a host, which they live inside. COVID-19, they say, came from bats or animals in China, and it transferred to a human host, which it can live inside. But it cannot live, like HIV, cannot live inside a mosquito.
Okay.
Yeah, so that host is not viable or cannot provide that environment that the virus needs to multiply. But us as humans, we have that environment where COVID-19 can live. So if a mosquito bites my colleague and contracts COVID-19, the COVID-19 just does not reproduce and dies off. And by the time it bites me, it does not have any effect, yes.
Oh, okay.
Yeah, so
We are running quickly out of time, so we'll just look at just one more myth. Says if you are healthy and get infected with COVID-19, it won't make you seriously ill.
Okay, so the definition of being healthy is different from person to person.
Yes.
So we would really want to know, are you healthy? Because if you're walking without a diagnosis yet, that doesn't mean you're healthy. If you have gone through, your doctor has checked you, everything has been checked, it's fine, then we can say, oh, you are healthy. But most people in their eyes, they are healthy. So I would want to say, take the healthy part with a pinch of salt. But of course, the data that we have for COVID-19 deaths, mortality and morbidity, meaning how many days you spend being sick and what are your chances of dying, it has been shown over and over again that if you have a comorbidity, if you have another diagnosis that you already have, say for example, you're already hypertensive, you're already diabetic, when COVID-19 infects you, you are at a higher risk to getting sicker, you are at a higher mortality risk. But I would like to underline that being healthy doesn't mean just because you don't have a diagnosis yet, so you are healthy, because we know people call themselves healthy, even though they are not.
And we have seen healthy people drop dead.
Yes.
Healthy in quotes. So thank you for addressing those. Now, as we are closing, we have heard, many of us, we are from the Christian community. We hear that when COVID hit, or a pandemic, it was the end of the world. Now you are Christian doctors. Would you like to comment just in 30 seconds on that one?
Okay, we all want Jesus to come. We can all see the signs of the times happening around us. We all do agree that the second coming is close. But these pandemics happening, they're not like spelling doomsday to us. We cannot now set dates to say, so God is going to come after this COVID pandemic. It's not a way to scare anyone away. Don't take the pandemic out of context. Take it within the context of everything else that's happening in these end times.
Okay.
Yes.
Thank you very much. 10 seconds. My time is really up now.
There were pestilence and pandemics in the Bible.
Yes.
The world didn't come to an end. Jesus came and explained that these things will happen before he comes. See it from a comfort point of view, to see that the second coming is close.
Yes. Thank you very much, Doctor. Thank you very much for joining us in this episode. I trust that you have taken some notes as we were going through this episode. I trust that if you were one of those that were struggling with some of the myths that we were discussing today, it has brought some clarity in your life. But more importantly, as you have heard, pandemics come about because things fall apart in terms of protections and protocols. So you and I have got a personal responsibility to do our part, to follow those protocols, to do all the things that are supposed to be done to stop them from spreading. We are not going to make Jesus come sooner by spreading epidemics around. Read your Bible, understand, because the signs of the time are very clear on when and how Jesus is going to come. Thank you very much for joining us today, and I hope you will tune in next time to hear more from This Is My Health.